In this video from Oversight, we are going to explore Avoidant Personality Disorder. I'm Dr. Gerald Richardson, and let's begin with the objectives. We will first cover the diagnostic criteria for Avoidant Personality Disorder, then explore some of the common features. We will compare several disorders that have social avoidance as a characteristic, then discuss the prevalence, development, and course of avoidant personality disorder, and conclude with the current understanding regarding treatment. The DSM, or Diagnostic and Statistical Manual of Mental Disorders, defines avoidant personality disorder with the following diagnostic criteria: a pervasive pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation, beginning by early adulthood and present in a variety of contexts, as indicated by 4 or more of the following. 1. Avoids occupational activities that involve significant interpersonal contact because of fears of criticism, disapproval, or rejection. 2. Is unwilling to get involved with people unless certain of being liked. 3. Shows restraint within intimate relationships because of the fear of being shamed or ridiculed. 4. Is preoccupied with being criticized or rejected in social situations. 5. Is inhibited in new interpersonal situations because of feelings of inadequacy. 6. Views self as socially inept, personally unappealing, or inferior to others. And 7. Is usually reluctant to take personal risks or to engage in any new activities because they may prove embarrassing. So now that we have the definition for avoidant personality disorder, let's explore some of the common features. The key characteristic is that there is a significant fear of criticism, disapproval, or rejection. If someone is only slightly critical, individuals with avoidant personality disorder may be extremely hurt. There are feelings of inadequacy and inferiority. Individuals with avoidant personality disorder are often shy, timid, or quiet. And these individuals tend to avoid work activities that involve significant interpersonal contact. They may decline job promotions because they are afraid of failing at new responsibilities, which would result in criticism from others. Similarly, they may tend to avoid social settings and making new friends due to a fear of criticism or rejection. Often they may assume that everyone else is highly critical or disapproving. However, these individuals still tend to desire relationships and social engagement, but their fears prevent them from doing so. And a consequence of this lack of social support may be significant problems in the lives of individuals with avoidant personality disorder whenever they are in times of crisis and they don't have that strong support system. And because they still desire relationships, but their fears prevent them from pursuing them, one of the observed features of avoidant personality disorder is the defense mechanism of fantasy. They may fantasize about having relationships with others. Now, these individuals are still capable of relationships, including intimate relationships. However, individuals with avoidant personality disorder typically only have intimate relationships when there is assurance that their partner is not critical. And due to this fear of criticism, these individuals often don't share their emotions or their feelings or their thoughts with their partner, due to the concerns that they may be exposed or shamed. Individuals with avoidant personality disorder are considered to take a restricted lifestyle due to fearing the potential dangers of ordinary situations. These individuals may also be obsessed with thoughts that they may cry or blush if they encounter harsh criticism. These individuals frequently have difficulty finding traits within themselves that they think others would view as positive. And unfortunately, individuals with avoidant personality disorder may be prone to self-harm. So it's clear that individuals with avoidant personality disorder avoid social settings. However, there are several diagnoses that may involve the individual actively avoiding social gatherings or pursuing relationships. There can be overlap of symptoms among different diagnoses, but as a quick way to tease out the correct diagnosis, especially for clinical vignettes on exams, consider the following. For avoidant personality disorder, these individuals avoid social settings primarily due to the fear of rejection, although they still desire relationships. If we compare this to social anxiety disorder, these individuals avoid social settings primarily due to fear of embarrassment, although they still desire relationships. So the similarity between these two disorders is that they both avoid social settings, although they want to have relationships. In avoidant personality disorder, you're looking more for concerns that the individual is fearing being rejected for who they are. Whereas in social anxiety disorder, it's more of embarrassing themselves, whether they are laughed at for how they dress, or maybe they say something that was embarrassing. The difference between those two can help you tease out the correct diagnosis. And then also in schizoid personality disorder, these individuals will avoid social settings, but that's because they are happy on their own and they do not desire relationships. So if you are a clinician and you're working with an individual and you have concerns of them avoiding social settings, the first thing to consider is, do they want relationships, or are they happy on their own and they don't want any relationships? That will help tease out between avoidant personality disorder and social anxiety disorder versus schizoid personality disorder. Now, if the individual is still desiring relationships, then to tease out avoidant personality disorder and social anxiety disorder, you would want to consider their reasoning for avoiding the social settings. Are they more primarily concerned with rejection or more concerned with embarrassment? Now again, there is overlap of symptoms, but for a quick way to differentiate these disorders, this is a good reference. So now let's move on to discuss the prevalence, development, and course of avoidant personality disorder. Avoidant personality disorder typically begins in infancy or childhood with shyness, isolation, and fear of strangers or new situations. But this does not mean that if a child is shy, they're going to develop avoidant personality disorder. Most shy children do not develop this personality disorder. But because these characteristics may be inherited, there is some support for a genetic component of developing avoidant personality disorder. But just as important are environmental factors and childhood emotional neglect, especially rejection from a parent, is associated with an increased risk for developing avoidant personality disorder. There is some evidence that suggests that this disorder may remit with advancing age. The prevalence is roughly 2.4%, and it's about equal in males and females. Some of the common comorbidities with avoidant personality disorder are the following: depressive, bipolar, and anxiety disorders, especially social anxiety disorder, and other personality disorders such as dependent, borderline, paranoid, schizoid, and schizotypal personality disorders. And the course of the disorder is that it is typically a chronic, long-lasting condition that may not improve even with treatment, but as mentioned before, it may remit with advancing age. So next, let's discuss the subtypes of avoidant personality disorder. These are not described in the DSM, but Theodore Millen described a few subtypes that you may encounter. First is phobic avoidant. This includes dependent features. The individuals are typically characterized as being apprehensive. Next is conflicted avoidant. This includes negativistic features, and these individuals fear dependence, they're unsettled, and have unresolvable angst. Next is hypersensitive avoidant, which includes paranoid features. These individuals are intensely wary and suspicious, panicky, and terrified. And finally is self-deserting avoidant, which includes depressive features. These individuals will block self-awareness and discard painful memories. And to conclude, we will discuss the treatment for avoidant personality disorder. Individuals with avoidant personality disorder may avoid individual therapy due to their fears of being rejected by the therapist. The goals of therapy tend to focus on challenging the individual's exaggerated negative beliefs about themselves. And like most personality disorders, medications may or may not provide any significant benefit. It depends on the case and the comorbid conditions. So if the individual has anxiety disorders or depressive disorders, then medications may be more beneficial. But there are no first-line psychopharmacological agents to treat the core of avoidant personality disorder. And that concludes our discussion on avoidant personality disorder. Thank you for watching, and be sure to check out oversight.com for more helpful resources.